Okay, we have a really interesting and important topic today, and that is bowel movements, your stool. What's a normal bowel movement? What's an abnormal bowel movement? When should I be concerned? When should I seek medical attention? Dr. Bob Ganz, board certified gastroenterologist. And remember, your stool is my bread and butter. Okay, let's go from there. So, normal bowel movement, there's a wide range of frequency of normal bowel movements in America. Anything from 3 bowel movements per day to 3 bowel movements per week, we consider normal. You don't have to go once a day or twice a day to be considered normal. 3 per day, 3 per week, that's considered normal range in America. So if you're in that range, you're good. Now, your stool should be brown or dark brown in color. That comes from bacteria breaking down bilirubin in the gut. Bilirubin goes in the gut, bacteria break it down, turn it into stercobilin. That imparts a brown or dark brown color. If your stool's not brown or dark brown, that could be a problem. White stools or pale stools imply that you're not getting bilirubin into your gut. That can come from a gallstone, obstructing a bile duct, or a tumor. If your stools are white or pale, that's a big problem. That means you're not getting bilirubin in your gut. That should be checked out. If you have black stools imply upper GI bleeding or foregut bleeding. Acid, which is in the upper GI tract, foregut, turns blood black. So if you have blood in your foregut, acid will turn that blood black, give you black stools. That implies GI bleeding. If you have black stools, that should be checked out. Now remember also, however, that bismuth, so Pepto-Bismol, can also turn stools black. So that's a caveat there. Red stools implies lower GI bleeding. There's no blood in the there's no acid in the lower GI tract. So if you have blood in the lower GI tract, it's not going to turn black, it'll stay red. So it can be hemorrhoid, fissure, diverticular bleeding. If you have red stools, that should be checked out. Green or yellow stools implies rapid transit through the GI tract. If your stool's moving really quickly through, the bacteria won't have time to break the bilirubin down into stercobilin. So green or yellow stools, that's a color of bile. Those are colors of bile that haven't been broken down yet. So that's what that implies. Floating stools are normal. You don't have to worry about floating stools. Floating stools means there's gas in your stool, either from drinking a carbonated beverage or eating foods that generate a lot of gas. Air bubbles float to the top, so stools containing air will also float to the top. That's perfectly fine. However, oily or greasy stools, if you see oil droplets in the stool, that's a big problem. That implies malabsorption. So if you see oil or fat in your stool, that could be a problem. That could be pancreatic insufficiency, or that can be celiac spruce, something that's causing malabsorption. Malabsorption will give you fat in the stool. Okay, I think I'll close out there. So that's my stool primer. So now you're informed. Any issues with the things I talked about, check it out with your physician. Okay, there you go.